You're watching Healthy Minutes with Dr. Mo.
Welcome back. Now, there are different types of alopecia or hair loss, most common of which is the male pattern baldness, which could affect half of all men by the age of 50. There are different cures out there, and the treatment depends on the cause, its efficiency, on a case-by-case assessment by a professional. We sat down with consultant Dr. Rana Al-Ammadi, who told us all about fighting hair loss and the different hair transplant techniques. Let's take a look.
Basically, a hair transplant meaning that we transplant the hair from the donor area, which is the back of the head, to the recipient area, which is the front of the head. Usually the hair follicles, the hair is composed of hair follicle and hair stem. So the hair follicle in the back usually does not get affected by the hormone in the body, so they survive. The hair in the front, they get affected in some people with the hormone, so they die. So that's why we remove the hair from the back, we bring it to the front, they survive for life. But the technique of removing the hair, placing it from the back to the front is different from one technique to the other. So hair transplant basically started 40 years ago. The oldest technique is called the strip technique or follicular unit transplant, FUT. And they used to cut a piece and they stitch it. And that was very painful. It leaves a scarring and it will consume all the donor area. Later on, the technique was developed and a newer technique was developed. It's called FUE, follicular unit extraction. Instead of doing one big cut, they will do small cuts. They are too tiny that they don't need stitching. And then they will do a recipient hole in the front. And then they will remove the hairs from the back and they will put it in the hole. This is a better technique than FUT, but still it will leave permanent scarring in the back. Especially for gentlemen, they want to shave short, it will show the scarring. It's slightly painful procedure because there is a cut and there are holes, and the result will look that you can tell that the patient had hair transplant because of the hairline. It will look artificial. DHI, they came and modified FUE and they call it a direct hair implantation technique. Basically, they have two instruments. One is the extractor. They will use it in the donor area. They will extract hair with no cutting, no scarring, no bleeding. And for ladies, we don't need to cut their hair or shave their hair. And then they use another instrument called implanter. They will put the hair and the doctor will just press without recipient hole. So there will be no pain, no swelling in the face or minimal swelling, and the doctor will have a control over the direction, the depth and the angle of the hair. Because if you notice around us, every person has different hair styling direction. Every single hair in your head had different direction angle. So we will follow the natural hair direction as much as possible, and then it will give you 100% natural results. Many people, they confuse hair loss and hair fall, and everybody think that they need a hair transplant, and that's not true. Hair falling meaning that the follicle is still there but the hair shaft is falling, and this happens usually after stress, after going through disease or surgery or nutrition deficiency, or after delivery of a baby for ladies. In those cases, these ladies will see a lot of hair falling, but the follicle is there. So in this case, we don't need to do hair transplant. A good doctor can differentiate between hair fall and hair loss. Usually we treat those cases according to the causing factor, and we do blood tests to exclude what could be the underlying cause, and then we treat them accordingly. Some of the treatment method in those cases will be multivitamins, a supplement which will be specifically targeting hair, and we could do mesotherapy or PRP, platelet-rich plasma, which is a very popular treatment, and it's not a myth, it's a scientifically approved treatment for hair falling and also hair loss, but they will not need hair transplant. The cases that will need hair transplant, usually the people who had hair loss, and that meaning that they lost the hair follicle. The hair follicle is not able to produce a new hair anymore, and most likely it's genetic predisposing, but recently we see more and more cases, younger people suffering from hair loss, and it's called in the medical term androgenic alopecia. And unfortunately we see a lot of ladies also suffering from androgenic alopecia. In this case, then the most suitable solution will be hair transplant. We make sure that we don't consume the whole donor, and we utilize it as needed, because it is the storage for life. So if we divide the hair loss into 3 zones, zone A, zone B, zone C. Usually people start losing from zone A, and then the crown area, this is zone C, and then the middle, zone B. And then we measure the area, we count the hair in the donor area, and then accordingly we can tell how much hair each person have as a storage to cover which area. So there are priorities, and usually in this part of the world we have around 90 to 100 hair per cubic centimeter. So when we want to do a hair transplant, we don't consume all the hair in the donor area. We don't want to transfer the problem from the front to the back. We have to leave the back with a decent number of hair that it will look unaffected and natural and untouched. Usually we leave around 64 to 70 hair per cubic centimeter. Anything more than that, we will use it for hair transplant. First they have to see a doctor. Once the proper diagnosis is done, they should understand what are the underlying cause, and that there are available treatments out there. We don't usually jump to hair transplant. We go stepwise according to the need. Sometimes we just treat them with some medication, minoxidil spray or finasteride tablets that could do, and then we can also treat them with platelet-rich plasma before we can go to hair transplant. They should understand that this is genetic and familial. There is nothing they can do that they change it, but they can delay it, and there are solutions out there. We have different techniques to deal with the patient who lost their hair and they don't have enough donor to do a hair transplant, either with, especially for men and ladies, we have done it, micropigmentation. It's like a small pigments in the head that will give the illusion of hair. It's more like cosmetic treatment. And recently we just introduced to the clinic synthetic hair transplant. It's more of biofiber, and this is good for ladies, especially that they don't have enough hair all over. They are not eligible for hair transplant because they don't have enough donor area, and that's a life-changing for most of the ladies, because losing hair for a man is traumatic. For a lady is even more traumatic.
You're watching Healthy Minutes with Dr. Mo.